lymphadenopathy? Did you study this one?
Sure, but I can try it.
Okay, let's see. They brought it many different versions. Like one of these stations is just to like to tell the patient you have HIV. Like he came earlier, you are GB, and he came for his result. Like to discuss that, to tell him you have HIV. And some station, they brought them with the symptoms of HIV, like he had generalized lymphadenopathy or she had weight loss, whatever. So you need to do HIV workup. So 2 different stations. Okay. So tell me first, like what symptoms you would ask in HIV?
I mean, sexual history is very important. Then use of recreational drugs or needle sharing, any kind of recent surgery, because to take the history of any blood transfusion, and yes, like in the history, these are very important. And symptoms, the patient will have this generalized lymphadenopathy, weight loss. They can have fever, low-grade fever long term. Then any kind of abdominal symptoms or any kind of infection like immune compromised state.
All right. Yeah.
Other than this,
As you said, symptoms, the most important symptoms, like constitutional symptoms of HIV, flu-like symptoms, fever, weight loss, sweats, lymphadenopathy. So this should be included in all station, HIV station. It has to be included. We have also PCB station, like coming with chest infection. Okay, and also you need to check for complications, like just you can just ask about headache, neurological symptoms like convulsions, shortness of breath. Yeah, this kind of symptoms you can ask. Also, HIV can cause cancer, so we're already going to ask about weight loss and light sweat. And also can cause skin rash also, so we'll ask about skin problem, isn't it? So also it causes lots of mouth problem, lots of different kind of ulcers. So you can ask about rash in the mouth as well and in the body. Okay. What else, like in terms of management, or what you're going to do?
we need to refer the patient to the gum clinic. Like apart from doing this HIV test, we need to do the other STI screening. Then the patient should be started on antiretroviral therapy, and partner notification should also be done here. And also advise the patient about safe sex. Those things like not giving blood.
Okay. And also like in the treatment, because this is like bad news, so you have to reassure the patient like treatment, there is more effective treatment nowadays, and some people, like most people, can live normal life with HIV. So just you need to offer lots of reassurance here. Okay.
Sorry, On the issue of partner notification,
Yeah.
is it the doctor that notifies the partner, or you request the partner to also notify their partner and probably ask them to come for testing as well?
Well, you can tell the patient to tell the partner, but you need to also tell him because he might tell you I can't tell, or he even if he, like in the real life, even if he said tell you okay I will tell, you can't guarantee that. So you need to mention about partner notification program. So it's like anonymous program, and we don't mention your name, but we need to recall your partner to the clinic to make sure they are get tested as well. Is it okay to give us all the names of the people who had a sexual relation with over the past year or 6 months maybe? So it's really important, yeah, to mention about partner notification program. Even if he tell you yes, I will tell them, you can't guarantee that. This is HIV, is not something like other sexually transmitted disease.
I see. Before starting the patient on treatment,
Yeah.
normally they say we need to roll out TB.
Yes, this is very good point. Yeah, like if you had any immunocompromised issue, like using steroid, whatever. So, but we don't need to worry in PLAB2 about too much detail. So you can tell him, asking the history, like, do you have any chest infection? Are you taking steroid, whatever? So because the treatment will be different according to their status.
Okay.
Yeah. So as you mentioned, antiretrovirus therapy, and you also can tell about long-term monitoring and follow-up with the GP regarding his medications. And we will do regular blood tests to check your immune status. And if you prescribe any medication, you have to give some warning about side effect. And if you develop any side effect, please come back to us. These kind of things.
Mm-hmm.
All right. That's all about it. So it's just, I think, it's just tough news, because especially the station, this one we're going to do now, he's young, he's very young, and he doesn't, like, he's fit and well. He doesn't expect to have any problem. He just came after he had a holiday, had unprotected sex in holiday, and he came for checkup. So it would be like big shock for him. So I think the way we deliver the news, we have to be careful, offer reassurance, and check he's fine, and follow up on him, make sure he's going to be okay. All right, so let's do it. URFI2 in GB, John, 28 years old, has come to you to discuss his blood test, which showed HIV positive. Please discuss the result with him and discuss initial plan of management and address his concerns. Yes, ma'am?
Yeah. Shall we start?
Yes.
Okay. Hello.
Hello?
One of the doctors here in this GP clinic. You must be John.
Yes, hi.
John, can you please confirm your age?
28.
So John, from my note, I can see that you are here for your test result, right?
Yes, right.
So John, is it okay if we have a chat about your condition, about like what you are facing, or would you like me to tell you the result first?
Tell me the result first.
So can you please, before that, just can you please tell me why did you do this test in the first place?
But you asked me to tell me the result, isn't it?
Yes. Okay. So John, do you know what kind of test you did?
Yes, I did HIV test. Sorry?
Yes. So John, we have done this HIV test for you, and unfortunately, John, the result is not something that we were expecting for, and I'm really sorry to say that your HIV test result has come out to be positive. John?
I guess I couldn't expect you to tell me this.
Sorry that I have to be the bearer of this bad news, but we really care for you, and we have to be open about any kind of condition that you are having. So I'm really sorry to say that it has come out to be positive. So
All
John,
right. Okay, so what are you going to do for me?
that you are upset with the test results. So how is your reaction right now? Like, how are you feeling?
Feeling bad, of course.
John, do you have anyone, like, would you like to call anyone to support you right now?
No.
You mentioned that you want to know like what we are going to do for you, right?
Yeah.
For that, can you please tell me like how are you doing? Like, do you have any physical symptoms or any kind of problem that you are having?
No, I don't have any problem. No.
So John, as the HIV has come out to be positive, so I can assure you here that the modern treatment, it has changed quite a lot, and we have a lot of we have different medications that we can give to you in order to fight against this HIV.
Okay, if you think so.
We have a treatment which we call antiretroviral therapy, because you know this HIV, it is caused by one kind of virus. So this therapy, it is not just a single drug, rather it is like a combination of different drugs that we will be starting you on.
All right.
It's because John, but before that, obviously, I will talk to my senior. The reason is we don't give just one antiretroviral, because this HIV, they can change their body and their shape, and they can become resistant to one of the antiretroviral drug. So that's why we give in combination, so that the combination of drug, it can fight against that virus.
You don't need to scare me more than this. I know, no problem. Yeah, just give me what you think is going to cure me.
John, may I know, are you currently sexually active?
Yes, I am.
Do you have any stable partner?
All right, so let's do it straight away. Let's do it from the beginning.
Yes.
All right. So don't give the patient option to discuss the result or not. So to keep our structures, we will never discuss any result before the investigation part. So just if the patient tell you, can you tell me the result right now? Ask him, is it okay just to ask you a few questions to be in a better position to discuss the result in a better way and to address your concern, whatever sentence you can say to explain why you delayed answering his concern. But don't ask me, should I tell you the result now or not? Because if you ask, if he tell yes, your station is finished. You can't just tell about HIV and just ask me. So you asking the history again, and you coming back to the management and going back to the symptoms. So disorganized and breaking bad news all at once. This is not good for the examiners. Let's do it again. So tell the patient, even if the patient tell you, doctors, I'm here to discuss my result with you. So tell him, yes, I have my results here with me. However, is it okay to ask you some few questions to be in a better position to address all your concerns? He will definitely say yes, because in the real life, they will say yes. No one will tell you, but just tell me the result. And it never happened even in PLAB2. So they will give you a chance as far as you explain it. I'm asking you a few questions for the sake just to explain this result in a better way. Not for anything. I'm not ignoring your concern. I'm going to address it shortly, but I will ask some questions to discuss the result in a better way. Because if you told me you have HIV, I will not answer any question for you. Even I found it very difficult, because sometimes I feel I'm real patient. So if I can't concentrate anymore. I can't tell you about my symptoms, my partner. It's all worthless. You're telling me about HIV now. So how I could answer you? So always delay, especially if it is bad news. You have to collect as much data as you can, and you have to make sure the patient wants the bad news. Don't tell me without my permission. And you have to make sure if he needs someone to be present while discussing this news. Yeah. So going the same orders, symptoms I have, like what made you do this blood test in the first place? If he told you just screening, whatever, is still, by any chance, do you have any symptoms? If he said, I'm fine, just to confirm, still ask your checklist of HIV. You know the patient has HIV. Ask all the symptoms you want to ask. Goes to the past medical history, go to, and with signposting, like when you finish some part, history of present illness, thank you so much, thank you him. And now just I need to ask you some quick background question about you, if that's okay. He said, okay, ask him past medical history. Now, thank you so much. Now I would like to ask you some personal questions. Is that okay? Sexual history. I'm really sorry. It might sound a bit intrusive, but it's really important to learn a little bit about your sexual life, if that's okay by you. He said, okay. Any history of unprotected sex, how many partners. So HIV, we need to take detailed sexual history. And then in the examinations, also mention it, and then discuss the investigations. Because even the management, you can't give me treatment and you don't know if right now I have BCI, for example, I have shortness of breath, I can't cope with it. Even if the patient tells you fine, still you need to confirm. Even in the real life, the patient will tell you I'm fine, but they have many symptoms they don't want to discuss. They don't feel it's important or are related. So they don't want to bother you as a doctor. But when you mention them, they will tell you, yes, doctor, I have this, I have this, I have this. Okay. So let's start from the beginning. Don't ask me to discuss the result. Just ask me straight away, is it okay to the, if I told you I'm here to discuss the result, yes, I have the result. Is it okay to ask you some few questions to be in a better position to address your concern? Okay, let's do it again.
Hello.
Hello.
I'm Dr. Asmanusta, one of the doctors here in this GP clinic. You are John, right?
Yes.
Can you please confirm your age?
28.
How can I help you? So John, from my note, I can see that you are here for your test result.
Yes, that's right.
So John, is it okay if we have a chat about your condition so that I'll be in a better position to explain the test result to you?
Yes, it's fine.
So John, can you please tell me why did you do this test in the first place?
I went to the holiday and I had unprotected sex there. So just I felt scared and I showed I should screen myself from all sexually transmitted disease.
I really appreciate that you had given it a thought about doing this screening test. So John, can you please tell me where did you go? Where have you been?
Does it matter? I went to Italy.
Okay, it doesn't matter. Okay, so John, apart from that, like after coming back from your holiday, did you had unprotected sex later on after coming back here? I mean, recently?
Yes, I do have sex with my wife every day.
Okay. So, John, do you have any kind of physical problem that you're facing right now? Any symptoms? I mean, any symptoms?
Not really.
Just to make sure that everything is okay with you, John, are you feeling feverish?
No.
Have you noticed any unusual swelling at any part of your body?
No.
Has anyone told you that you look thinner than before?
Do you mean weight loss?
Yes, exactly. I mean, any unintentional weight loss?
No.
Okay. And how about your appetite?
It's fine.
John, are you having okay, have you recently had any flu-like symptoms?
No.
Okay. And John, you mentioned that you are sexually active and you have wife, right?
Yes.
So apart from your wife, do you have any other casual partner?
Not really.
Okay. And you mentioned, do you practice safe sex with your wife?
Not really.
John, just to make sure, can you please this kind of sound? Can you please tell me about your so John, like about your lifestyle, just to make sure that I am in a I can explain to you everything. Do you drink alcohol, John?
Okay, so do you want to ask medical history first?
Okay. Okay. So John, have you ever been diagnosed with any medical condition?
No.
Okay. And are you currently taking any kind of medication?
No.
Any over-the-counter drug?
No.
Are you allergic to any medication?
No.
Okay, that's really good. John, just this might sound intrusive that I'm invading your privacy, but this is an important question that we ask. Do you take any kind of recreational drugs?
No.
Okay. And did you recently had any kind of surgery or any incident of like blood transfusion?
No.
Any recent tattoo?
No.
Okay, okay. So John, is it okay? Thank you very much for cooperating with me, for bearing and answering all these questions. So is it okay if I examine you now?
Yes, sure.
So I'll be checking your general physical examination, your observation, and also I'll check for the glands, for the lymph nodes in different parts of your body. Okay?
All right, that's fine.
John, coming to the test result, I have the test result with me that you have done the sexual screening test. So, John, are you alone to this hospital today? Like, have anyone accompanied to you in the hospital?
Not really.
Well, John, as a doctor, we have to be like open with our patient. And so, John, in your test result, the test result is not something that we were expecting for.
What do I have?
We have found out that you have come out to be HIV positive.
Oh, really?
I really can't put myself in your shoes, and I can't even understand how you are going through, like how this news has left you. So, John, anything in your mind that you would like to say now?
To my knowledge, is very serious disease, but is it treatable?
Well, John, this is not a serious disease because recently we have a lot of medication that we can offer to the HIV positive patients. And the HIV positive patient, they can lead the life of a normal, like just like the other people, if they take their medication regularly and can keep the virus under control.
All right.
So John, I can reassure you that whether like before it was a serious condition, but recently because of this advancement in medication, we have a lot to offer for you. Okay.
Okay.
So John, like for now, what we're going to do, I'll be talking to my senior. We might have to, or we might refer you to the genito-urinary medicine, genito-gum clinic. Will that be okay with you?
Can you give me treatment straight away, or does I have to go there?
If we want to give you treatment for that, I will be talking to my senior. Then we can start you on this like antiviral medication against this HIV.
Okay.
And apart from this, John, as you have mentioned that you had this unprotected sexual intercourse after coming back from the holiday with your wife, it's very important, John, that you involve your wife regarding this. So what do you think about that, John?
She will know that I was cheating on her, and it will be a big problem, you know.
I can understand it's going to be affect your conjugal life, but John, the thing is like, you know, this kind of infection, they are transmitted by these sexual routes. So even if you are getting this treatment, and for example, if your wife is infected with HIV, she might again transmit this infection to you, or like to you again. So it's very important.
Move on to the next station.
Okay, so I can't tell her anyway. Can you just tell her for me?
Yes, sure. We have an excellent program in our clinic, which we call the partner identification program. We will then like talk to your wife via this program. Okay.
All right.
And John, the thing is like try to stick to your medication as it will be prescribed. And please don't transfuse any kind of blood, or please don't like abstain yourself from doing any unprotected sexual intercourse while you will be getting this treatment. Okay. And John, it's very important that we will follow you up regularly to check that you are compliant with your medicine and you are not having any complications from the HIV. Okay.
Okay.
And, if at any time if you feel that you are losing weight, or you are feeling feverish, and any kind of infection you are having, like any kind of flu-like symptoms, please come back to us. Okay.
All right. Yeah.
Thank you.
Good. Yeah. Well done. Good. Good. Even like IBS, you tried. You gave me 2 or 3, so I would consider you did very well.
I find breaking bad news is the toughest, like challenging, very much.
It is challenging, and anyway, like many people, they don't pass this station because even the actor, his native English, he's talking so fast, and I don't know, but like many people, they tell me either they failed it or get not good marks in the breaking bad news. But do your best and get during practice, try to. So this one, because the session is too long, we don't break it in the ideal way. So at least just you ask about someone to be present and offered him support. That's more than enough for this HIV station. Yeah. But for the other stations, breaking bad news in steps, as I said, just the more you ask the patient, more before you volunteer any question, just ask first and then address concern and move on. Your life will be much easier rather than try to guide the station. Let them guide it for you. It will be more efficient. Yeah. All right, but I think we did it very well. Very well done. You wanted to ask me personal history before past medical history. What is good, like you fix it and you ask all the necessary questions. You ask about medical history, sexual history in a nice way. You signpost it. You use some positive language. You appreciate it that he did some screening, and you acknowledge his feeling when you deliver the result, and you ask him about his concern or if he has any question when you deliver the news. So I think you did very well. Yeah. So always remember in PLAB2, structures is the major, like it will fail you if you have disorganized history, especially if the examiner is native English.
Mhm.
They had two things. They had disorganized doctors, and they had someone who interrupt. Like if the patient didn't finish talking, even like sometimes they pause for a few seconds and start talking again. So make sure, give them a few seconds, make sure they're not going to talk, because even if you thought he finished and you started to talk, both of you at the same time, they will consider it as you interrupted him. So this is the thing that they had too much, they can drop your marks so bad. So structure, as I said, always try to keep it in the same order, and not only the same order, because sometimes the examiner can lose concentration. So you need to signpost before each section to tell them, I'm now finished with this section, I'm moving to the other section. As at the same time, it's good communication, because you're telling the patient the reason why you're asking this group of questions, so they will not be distressed with it. Yeah, so it's very well done. Raymond, any comment?
No, I think she did well. Hello?
All right.